An important step tonight in the race for a COVID-19 vaccine. The National Institutes of Health and drug maker Maderna kicked off phase 3 testing in what is the largest vaccine study to date. 30,000 volunteers are expected to take part in a blind trial, meaning some will get the vaccine while others will get a placebo. Each person will get 2 doses, and scientists will track which group has more infections as they continue their daily routines. Pfizer also announced tonight that its vaccine candidate is entering phase 3 clinical trials. The company made it in partnership with German-based company BioNTech. In a statement, the companies say the trial will include up to 30,000 people between the ages of 18 and 85. Like Moderna's, it will be a blind trial where half get the actual vaccine while the others get a placebo. It will take place at 120 sites around the world, including 39 states in America. If successful, Pfizer will submit it for final regulatory review as early as October. Wearing a face mask is mandatory in many states, including Michigan, and even President Donald Trump is now encouraging Americans to mask up. Some people worry that wearing a mask restricts oxygen from getting into our body. But as Tai Wong reports, that's just a myth.
People believe that having a mask decreases your oxygen levels.
To wear or not to wear. Many states have enforced a face covering mandate in order to contain the spread of COVID-19. As much of the country is seeing a second spike in coronavirus cases, the debate over a face covering mandate continues on. Now, many people state that they don't like to wear their mask because it affects the way that they breathe. Now, I took that reasoning to the test here at Arnott-Ogden Medical Center.
Wearing a mask is proven to decrease the risk of transmission, not only for the person wearing it, but also for the person that they're interacting with.
At first, Dr. Nasir and respiratory therapist Bobby Hurlbert took my original oxygen and carbon dioxide levels without wearing a mask. Then I tested my levels 3 different times wearing a blue surgical mask, a cloth mask, and a makeshift covering with the bandana. The monitor showing my carbon dioxide levels in the yellow, oxygen intake in the blue, and how much I breathe in each minute in the white. Those findings?
The presence of a mask does not interfere with oxygen delivery or eliminating carbon dioxide from your body.
I also wore 2 masks to see if any changes would happen, but
having 2 masks on does not change the oxygen or carbon dioxide levels.
During my examination, I also did physical activity such as 10 jumping jacks and jogged in place for 30 seconds while wearing a mask. Data shows that the levels did change, but my body was actually receiving more oxygen when I was active. When asked about people who do have chronic respiratory diseases like asthma,
chronic obstructive pulmonary disease, and some of the other respiratory diseases are not a contraindication or a problem with wearing a mask.
He says there are very few anatomic diseases that prevent someone from wearing a mask, like if they depend on assistive devices.